Welcome to day 3 of our workshop, the last day. Today we will be discussing play therapy, telephone therapy, and anti-expectation therapies. Play therapy, what is it? It is a form of psychotherapy that is designed for the children and for the children that are ages between 3 and 11. Uh, it can help to resolve their psychological issues. There are two types of play therapy, that is the directive play therapy and non-directive play therapy. In directive therapy, the therapist asks the questions from the client. He will encourage patients to talk about certain topics like family, for example. It is a form of cognitive behavioral therapy. It is mostly used with the trauma victims. So children who have suffered trauma at their home, maybe physical abuse, or some other emotional neglect or emotional abuse. That's where directive play therapy comes in, and that's where it can be used. Sand tray therapy is used in directive play therapy, in which a sand tray is given to the child, and then the child is asked to play on the sand tray, and he is given some toys to play on it, and then whatever he changes makes in those sand tray, we ask them why they choose this particular item to change the sand tray, what changes they made. We ask about those from the child. Now, non-directive play therapy. This is the most common use of the play therapy. Um, this is also called the client-centered therapy for children. The therapist allows the child to do whatever they want. They can play with whichever object they want to play with. They can even dress whichever the way they want to dress. Usually, a play therapist has a set of clothes with him in the play therapy. So whichever costume they want to wear, they can wear that. If they want to become, let's say, a pirate, they can wear a costume of a pirate. Uh, and then they can play in whichever way they want to play. And the child in this therapy leads rather than the therapist. The child does whatever he wants to do, and then the therapist follows the child. uh, it is like it is made from the psychodynamic therapy. Psychodynamic therapy, as we know, cannot be used on children, as they cannot speak properly about their problems. So this therapy was developed to uncover their unconscious thoughts and actions. And it is derived from that psychodynamic therapy. It can be used with their behavioral problems. Now, telephone therapy. Uh, Therapy in this therapy is done with the use of a telephone. Um, the contact is made between therapist and the client using a telephone. Um, First impression that we make in a therapy session, even when we are meeting in a clinic, uh, in the telephone therapy, that first impression is made during a phone call. Uh, Telephone are used at the time of emotional intensity and crisis. Whenever a patient is feeling very angry or very, if he feels like crying all the time, and is in a state of crisis, telephone can be used at that time. Uh, if there is it is used exclusively when there is a distance between a therapist and the client cannot access the therapist. For example, if he's sick and he's sitting on a hospital bed, he cannot move, he cannot go to the therapist, he cannot walk to the therapist, so he can use a telephone to talk to the therapist. Uh, and there are also telephone centers established in many countries in which there is 24-hour service is available. You can anytime at any time call them to get psychological services from them. It offers an easier access to the therapist rather than going to the therapist, walking to the therapist. That is much more difficult. Now, this can be used in a structured and unstructured way. In unstructured way, this client is given the therapist phone number and encouraged to call whenever they feel bad. Meaning, if a person, what do we mean by feeling bad? Feeling bad means if a person feel like he's going to hit his kids, or if he likes he's going to drink again, he can just talk to the therapist. Um, at many times, anxiety is immediately relieved because the therapist is stated that he is capable of handling any emergencies and not afraid of patient's anxiety needs. Uh, some patients in the telephone they can bring up information they have not brought up in the regular sessions. Um, the patients which have a significant interpersonal difficulties, like schizoid individuals, will try to achieve closeness at the same time maintaining the distance. Uh, they will try to achieve the closeness using the telephone because telephone is a little different. You're not actually seeing the therapist, so they're able to get a little closer to the therapist by explaining their problems more openly, um, and which they are not able to do in the regular sessions. Uh, in sometimes the clients who have a problem with controlling their anger, they will use a telephone to express their anger towards the therapist. They will use the telephone. Since they cannot do it in the regular session in a clinic, they will use the telephone to express their anger towards the therapist. Some individual will talk things about their lives over the therapist. For example, uh, they will ask for advice on certain decisions, whether they made some decisions they were right or wrong, or what decision they should make. They make these. They can do that in the telephone. Now, there are abuses of the telephone, and the patient rarely abuses the telephone calls, but sometimes they do. Um, when a patient just starts abusing the telephone, the therapist should bring this directly with him, should bring this up with him that is abusing the telephone. He should tell him that, tell the client that he is abusing the telephone. Um, and that he is a therapist should try to make him aware of this side of his personality and tell him to bring this under control. Uh, it's in these cases it is sometimes best to have a regular time for the session and to work out a fee for them, meaning that if a patient is abusing the phone calls, we should try to have a regular session with them at the same time and charge a fee for them, and not do it for free since the patient is abusing the phone calls. But patients really rarely abuse the phone calls. They don't do it more often. It is very rare. No, in the telephone therapy, the first thing, the difference between this therapy and the regular sessions should be that the first thing the therapist should do is get the name of the client, their phone number and address. Uh, Now, if someone is calling and they have taken an overdose, um, and calling to discuss with the therapist what will be the outcome. In this case, the client should tell the therapist should tell the client that he's going to call the ambulance, and then the client should open the door. Rather than discussing it on the phone, so it is very important to get the phone number and the address of the patient, because then the therapist can ask for help, uh, can call an ambulance, or if a therapist is if a client is suicidal, then you can call the police as well. Now we come to the anti-expectation therapy. Uh, in this therapy, therapist acts opposite of the expectation of the client. It is done to break the resistance of the client. Uh, usually what when the client comes to the clinic, he will ask, he will have the expectation that the therapist will try to minimize his symptoms, and he will try to help him to reduce his problematic behavior. But sometimes the patients are so resistant and so in such a bad thought state that they think that even the therapist cannot help them. They just come to the session and a therapist is trying to help them, but they think the therapist cannot help them. They're in such a bad state. That's what they think, that they're in such a bad state, and the therapist cannot help them. So in this case, then the therapist what should do is, instead of trying to reduce the symptoms of the client, he should tell them to amplify it and reduce the symptoms rather than to suppress them or deny them. Uh, and then in this case, the client will not be able to resist, because in the therapy session, because there will be nothing to resist to. Uh, because the therapist is doing opposite of the what the client was expecting. Now, sometimes the behavior therapists have advocated for the negative practice, which means that repeated exposure to the stimulus will reduce its effect. Uh, Clients can take more control over their behavior if they tell themselves more self-defeating sentences while being made aware of what they're doing. Uh, For example, if in tick disorders, if a person is having tics, he comes to the therapist, and the therapist, instead trying to reduce the tics, tells them to amplify them and increase them. This repeated exposure to those tics will help them to reduce the behavior of the client, the problematic behavior of the client.